So thank you for the introduction. And maybe before we start, I hope you're okay on Zoom. I think I will start with my name. I am Alex Hinga. I'm a postdoctoral researcher at the Kemri Wellcome Trust Research Program, and I am based in Kilifi. So for today's session, we'll be discussing social and ethical considerations in health technology assessments. And before we start, I know this is coming at the end of an intense training on HTA, but I wanted to get a sense of how many people here have had any formal ethics training. Anyone who had any formal ethics training? Yeah? Or any ethics training? There are many.
When we are doing our thesis, we are conducting some research here and there.
Okay.
We get appraised
Mm-hmm.
around ethics, but maybe not deep like this.
So there was a module on ethics, and I'm assuming you have done, for those who have done research, done the ethics training, online ethics training, yeah, to get approval. So for today's session, this is how have designed the presentation. So first, I'll give a very brief background because I know you have been discussing HTA throughout the week. And then the next section will be about ethics, looking at ethical theories, frameworks, and principles. And then we'll come back to apply these ethics principles, theories, and frameworks to HTA. And we have two case studies. I'm not sure whether we'll get time to look at both, but I would like to actually get to one of the case study on the malaria vaccine implementation program. And then at the end, we'll have some discussion. So I know we are starting a bit late, but I think we'll try to manage the time. So as I said, as a brief background, we know that African governments do not allocate enough resources to health. So there are various types of financial constraints to the health systems. But countries at all income levels, high income countries, low income countries, the demand for health interventions and technologies surpass the available resources. And therefore, the resources should be used to purchase interventions and technologies that will offer the best value. Sometimes they say the best value for money. And for that, we need a process for prioritizing health interventions. This is very crucial. And this process, I know you have maybe discussed health priority setting, resource allocation, and I know some of you are actually in your work involved in health priority setting and resource allocation. As an overview, this prioritization can be implicit, where funding decisions are based on what has been funded traditionally,